Good evening, students. Welcome back to our channel, Ach'z. So today we had OET exam, the second test date of this particular month, 11th January. We already updated the complete review and the question paper discussion. And today, 25th Jan, it's the global test date for OET. So we are going to discuss about the different set of question papers which are available from India, different parts of GCC and also from European countries. So the available question papers we are going to discuss. So if you got any other category of question means, try to mention that in the comment box. So it will help the other students, those who are planning to write their OET exam soon. And for these all questions, I will update the samples in the upcoming days. Already we created a playlist to update the speaking samples and all which asked in the real exam. So which all are the role play cards I am going to mention, which means they asked in the real exam. We will come out with the sample section for that. So you can just cross check the playlist. And for this reading also, I will provide the material or we will make a discussion, especially for the part A section. Most of the students find difficulty to solve, so you will get the updated materials freely if I am updating in this channel means. So we will make the arrangements for that. Now coming towards the review, we will first discuss about the reading question papers. The first set, it was about multiple sclerosis. The test A including the definition and types, test B with symptoms and diagnosis, and the test C including the treatment options. In that they mentioned about the lifestyle changes and also about DMT, which means the disease modifying therapies, and the test D including the statistics and the risk factors. In that they mentioned specifically about the genetic environment and all. So those who don't know about the question category or the pattern, I just want to say that also 1 to 7 it was matching type, 8 to 14 gap filling type, and 15 to 20 it was like a short answer type of question. And in that set, C1 and C2, C1 including advances in stroke rehabilitation, C2 ethical dilemmas in genetic testing. And the set 2, it's about the sleep apnea. So the first test about the definition and types, in that they mentioned about the central, obstructive, like that different types. Test B including the symptoms and the diagnosis. Third portion with the treatment options, and the last part with the risk factors and complications. And in that the C1 and C2, C1 about the CPAP therapy and C2 about the workplace safety. Now about the third set of reading, Crohn's disease. The first part including the definition, second part including the symptoms and causes, third part about the treatment. So in that they specifically mentioned about aminosalicylate, corticosteroid, immunosuppressants and all. And the last part about the nutritional supplement and the stress management. So that's about the three different set of questions which we got under reading module. It's not about in the single sitting you will get all these and all, because many of them having, if especially for the beginners I'm saying, while I'm saying set 1, set 2, set 3, they will ask whether we will get all the set or not. It's not like that. It's collected from different centers. Okay, I just want to convey about all the type of question papers available now. Now coming towards the second module, writing. The first set of letter, it was a referral letter to a physiotherapist. So the situation like you are a nurse referring a patient who has had knee surgery, that means a total knee replacement for physical therapy. So you need to write a letter to the physiotherapist, including the patient background and the reason for the surgery, the post-surgery progress and the recovery so far, then specific areas requiring physiotherapy such as the mobility and about the strength, and any relevant medical history or condition that might affect the therapy. So that's about the first set of writing letter. And in the second set of letter, it was like a letter to a family member regarding a patient's condition. So the situation is like you are a nurse looking after a patient who is in a palliative care stage due to end stage cancer. So write a letter to the patient's family member providing an update on the patient condition, care plan or any advice for them in managing the patient's need at home. And coming towards the third set of letter, it's a discharge letter for a post-surgical patient. So a patient who has undergone hip replacement surgery is being discharged. So you need to write a discharge letter, and in that you should include a summary of the surgery and post-operative care provided, any ongoing pain management about the medication and the wound care instructions, then specific instruction for physical activity and rehabilitation at home, and follow-up appointments and sign to watch for that would require immediate medical attention. So that's about the third set of letter which we got. Now coming towards the next module, the role play card, that means the speaking section. So the first role play card, it's about the mother and child. So the scenario is like you are a nurse in a pediatric clinic, and a mother has brought her 6-year-old child for checkup. The child is experiencing persistent cough, mild fever, and the fatigue over the past 4 days. The mother is worried and would like to advise on how to manage the symptoms and when to seek further medical attention. So your role is to ask the mother about the child's symptoms in more detail, and you need to advise how to manage the symptoms at home, like the medication or hydration, the rest and all. Then discuss the signs of serious conditions that would require the child to return to the clinic or to the hospital again, especially if they having the difficulty in breathing or high fever and all, and also to reassure the mother. So that's about the first card. And coming towards the second card, again the setting is hospital ward. The patient has undergone abdominal surgery and is experiencing moderate pain. So they are reluctant to take the pain medication because they are concerned about becoming dependent on it. So you need to explain the importance of this pain management after surgery. Discuss the options available for this pain relief, including the medication or non-medication approaches. And you need to reassure the patient about the safety or about this prescribed medication, how it will help in the recovery and all. So coming towards the third role play card, so it's like giving discharge instruction to a post-surgical patient. So the scenario is like you are discharging a patient who has had knee replacement. I think in writing also we discussed this same topic. The patient seems anxious about the ability to manage the recovery at home, so particularly regarding the mobility and the pain management. So you need to provide a clear instruction on how the patient should manage their post-surgery care, explain the importance of physical therapy, rest, and also the prescribed medication. And you need to address all the patient concerns that may be related to this mobility, recovery time, and also reassure the patient. So that's about the third role play card set. Now we will discuss the last section, listening. Usually I will just mention about the talk from neurologist or cardiologist, simply like that. But in this section I thought of giving the explanation for a different set. So the first set, it was like a conversation between the patient and the orthopedic nurse. So patient with a severe knee pain has been referred by their GP for the follow-up regarding the potential need for surgery. And the second set, it was like listening to a consultation between the neurologist and a patient. So the patient with the symptoms of chronic headache and the dizziness. So patient is concerned about the possibility of neurological conditions like the brain tumor and all. And coming towards the third set, listening to a consultation between the GP and the patient. The patient is very tired and having constant low-grade fever. So the GP is trying to determine if the patient has any underlying conditions like the infection or any type of autoimmune diseases. Coming towards the fourth set, like the GP, talk from the GP. And it's about the medical consultation, including the patient medical history, the symptoms, treatment, advice and all. So that's about the set of listening. So that's about the different set of question papers for today's exam. So I hope you all attended well, and all the very best for your results. And as I mentioned before, we will come out with all the OET related updates and the updated materials also. So which all are the cards, role play cards or the reading which we mentioned under this today's section. We will come out with the sample or discussion for that in the upcoming days. So you can just subscribe and keep on watching this space to get more OET related updates. And if you want any other special videos, I know that I saw some comments in correlation with this common phrases and the vocabulary for the speaking section and all. Yeah, I will come out with that as soon as possible. For the listening section and all, we just created the list for the common vocabs, so you can just cross check the newly added playlist for the OET section. And in the upcoming days we are planning to do more OET related videos, so you can just watch on this space to be updated and to prepare for your exams. So all the very best and God bless you all. So you can also comment your experiences below. Thank you.